Hello and welcome to Healthy Life Channel, where we explore vital topics to keep you well informed and prioritize your well-being. Like this video if you're intrigued by natural health solutions. If you're new here, hit subscribe and enable notifications for our latest updates. Today, I will discuss the 7 signs that appear on your body and may indicate that your heart is not functioning at its best. Cardiovascular disease is the leading cause of death worldwide, so it's crucial to pay attention to these indicators. This video will be divided into 3 parts for clarity and depth. In the first part, I will cover the 7 visible signs that suggest something may be wrong with your heart. These are the physical indicators you can observe. The second part will focus on the 7 classic symptoms you feel when your heart is in distress. These are sensations and conditions you or a family member might experience. Finally, in the third part, I will provide valuable tips to help you avoid heart problems in the future. This will be a comprehensive video, so I encourage you to stay until the end. You are likely to learn many new things that could be vital for your health. But first, please give this video a like. The more likes it receives, the more YouTube will distribute it to people who might not have access to doctors or hospitals. Also, share the video with your friends and family. Tell me, do you have heart problems or think you might? Where in the world are you from? Let me know in the comments below. Now, let's dive into the 7 signs you should pay attention to that may indicate heart problems. 7. Frank sign. Starting today, you'll want to observe people's ears more closely. Why? Because there's a small sign in the ear that may indicate a blockage in the heart arteries, specifically the coronary arteries or carotid arteries. This is known as Frank's sign. In the 1970s, Dr. Sanders Frank noticed that many of his patients with angina, chest pain, had a diagonal crease in their ears, which he described as Frank's sign. The connection between the heart and the ear is thought to be that the same factors damaging the arteries can also cause this crease. Does everyone with Frank's sign have a blockage? No. Among 100 people with this diagonal crease, 30 have nothing, just a mark of age. But 70 might have a blockage. The younger the person, the more likely it is a sign of coronary or carotid obstruction. If a 40-year-old has Frank's sign, it requires more attention than an 80-year-old, where it might be due to age. The sensitivity of this sign is low. Only 40 out of 100 people with heart blockages will have this sign. So, there's no reason to celebrate if your ear is smooth. 6. Hair loss on legs. Hair loss on the shins, and later on the thighs, can be a sign of peripheral arterial disease, PAD, indicating blockage in the leg arteries. Atherosclerosis, which causes PAD, is a diffuse disease. If you have blockages in the leg arteries, you might have them in other arteries, including those supplying blood to your heart. Most people with PAD only notice something is wrong when atherosclerosis is advanced. Why does hair loss occur? Hair follicles need nutrients to grow, so they require good circulation. If your arteries are blocked by fatty plaques, sufficient blood and oxygen won't reach them. Besides hair loss on the legs, you might also have smoother and shinier skin, cold skin, and slower nail growth. However, hair loss on the legs can also occur for other reasons, such as genetics or friction from clothing. 5. Xanthelasma. Xanthelasma are yellow plaques that appear on the eyelids, particularly in the inner corners. These are cholesterol deposits in the skin, often found in middle-aged women. About 50% of patients with xanthelasma have dyslipidemia, high cholesterol or high triglycerides. Interestingly, only 1% of people with high cholesterol have xanthelasmas. However, having xanthelasmas increases the risk of heart disease, heart attack, and stroke. Therefore, if you have xanthelasma, you should get a blood test to check your cholesterol and triglycerides. In conclusion, recognizing these signs can be pivotal for early detection and prevention of heart disease. Stay tuned as we delve deeper into more symptoms and provide practical tips to maintain heart health. Remember to like, share, and subscribe to support our channel and stay informed about your health. 4. Arcus Senilis, corneal arcus. As its name suggests, Arcus Senilis is more common in older individuals and is characterized by a white or gray ring around the edge of the cornea, visible above and below the outer part of the cornea. In some cases, this ring can extend to cover the iris, the colored part of the eye, causing the eye to appear lighter. Arcus Senilis is caused by cholesterol deposits in the cornea and does not affect vision, nor does it require treatment. However, there is an important caveat. If this ring appears in younger individuals, under 45 years old, it could indicate severe dyslipidemia, which means very high cholesterol or triglycerides. This condition is associated with an increased risk of heart disease. While it is normal for older individuals to have Arcus Senilis, occurring in about 60% of people over 60 and almost 100% of those over 80, its presence in younger people warrants medical attention to check for underlying cardiovascular risks. 3. Cyanosis. Cyanosis refers to the bluish or purple coloration of the skin, which might occur if you are extremely cold. However, if this coloration appears while you are warm, it could be a sign of a heart or lung problem. Cyanosis indicates that the affected area is not receiving enough oxygenated blood, possibly due to a blocked artery. If accompanied by shortness of breath, it could point to lung issues such as pneumonia, empyema, pulmonary embolism, or heart failure, where the heart cannot pump enough oxygenated blood. Other heart-related causes, like congenital defects such as tetralogy of Fallot, can also cause cyanosis. 2. Ulcers. Non-healing wounds on the legs or feet might indicate poor circulation, often due to arterial insufficiency caused by an obstruction in the arteries supplying these areas. Individuals with arterial ulcers typically cannot walk far or quickly without experiencing tiredness, pain, or cramps in the legs. These ulcers are usually painful unless there is nerve involvement, such as diabetic neuropathy, which can mask pain. Arterial ulcers often appear on the outer part of the legs, heels, and toes and generally do not bleed. Venous ulcers, which are more common and related to varicose veins or venous thrombosis, affect the inner part of the leg and typically bleed. 1. Swelling in legs, ankles, and feet. Swelling, or edema, in the legs, ankles, and feet can result from a weak or dilated heart that accumulates fluid in the body. This swelling might cause your shoes to feel tighter, your ankles to feel spongy like bread dough, and when pressed, leave an indentation known as pitting edema. This type of swelling is more noticeable at the end of the day due to gravity increasing pressure in the leg veins. Elevating your legs can help reduce the swelling. 7 symptoms indicating heart problems. 1. Shortness of breath, dyspnea, disproportionate tiredness with exertion, making even simple activities leave you breathless, could indicate a heart problem. 2. Persistent cough with white or pink phlegm. This symptom suggests fluid in the lungs and should not be ignored. Seek medical attention. 3. Shortness of breath when lying down, using more pillows to sleep or needing to sleep in a chair and waking up gasping for air during the night. Paroxysmal nocturnal dyspnea indicates heart issues. 4. General weakness. Feeling constantly tired and struggling with daily activities like shopping, climbing stairs, carrying groceries, or walking suggests the heart is not pumping enough blood to meet the body's needs. 5. Nocturia. Waking up multiple times at night to urinate can have various causes, but if the heart is not pumping well, the body might need to eliminate excess fluid. 6. Intermittent claudication. Intermittent claudication is characterized by pain in the calf that occurs after walking a few meters. This pain is not constant. It only happens with exertion and improves when you stop walking. This symptom indicates that blood flow is insufficient to meet the demands of your muscles during physical activity. The pain subsides when you rest because the muscles are no longer demanding more oxygen than the compromised blood flow can supply. 7. Chest pain. If you experience chest pain, the first consideration should be a potential heart problem. While it could be due to muscular issues, gas, or something less severe, it's crucial to rule out heart-related causes first. Heart pain, also known as angina, typically manifests as discomfort or pain in the chest that lasts more than a few minutes. It can come and go, and it may feel like pressure, weight, squeezing, or burning. The pain can radiate to the left arm, neck, back, jaw, stomach, or both elbows and might be accompanied by symptoms such as sweating, paleness, nausea, and dizziness. If you experience these symptoms, seek medical attention immediately. How to prevent heart problems. 1. Exercise regularly. Staying physically active is vital for your circulation, heart health, and mental well-being. Low-impact exercises like walking, cycling, and swimming can help improve blood flow and reduce the risk of chronic obstructions in veins and arteries. 2. Quit smoking. Smoking significantly harms your health. It causes inflammation in the arteries, leads to the formation of fatty plaques, and increases the risk of heart attack, stroke, and dementia. It also contributes to impotence and overall cardiovascular damage. 3. Maintain a healthy weight. Excess weight increases blood pressure, exacerbates blood sugar issues, and places additional strain on the heart, kidneys, joints, and venous system, raising the risk of thrombosis. It also contributes to liver fat accumulation. 4. Eat a healthy diet. Focus on consuming fruits, vegetables, fiber, whole grains, and olive oil while limiting red meat and processed foods. A balanced diet supports overall cardiovascular health. 5. Be aware of family history. If you have a family history of heart problems such as heart attack, stroke, stent placement, or heart surgery, you need to be more vigilant. Regular, in-depth exams are crucial if heart disease is common in your family. 6. Manage cholesterol and triglycerides. Eat more oatmeal, avoid trans fats and saturated fats, lose weight, consume more fiber, and exercise regularly. If lifestyle changes are insufficient, don't be disheartened if your doctor prescribes medication, as 80% of cholesterol is produced by the liver. 7. Control blood sugar levels. If you are diabetic or pre-diabetic, keeping your glucose levels under control is essential to reduce complications. Aim for a glycated hemoglobin, A1C, level below 7%. 8. Monitor blood pressure. Aim to keep your blood pressure below 120/80ths of a millimeter of mercury. For some individuals, the target may be less strict, such as not exceeding 140/90ths of a millimeter of mercury. Regular monitoring and managing high blood pressure are crucial for heart health. If you notice several of the signs and symptoms mentioned, it's important to consult a doctor, explain your concerns, and follow their guidance. Did you find this video helpful? Please share it to help more people gain this valuable knowledge. Don't forget to subscribe for more health insights. Thank you for watching, and see you in the next video.